return demonstration, I will be performing pulmonary chest physiotherapy and postural drainage. So first, I will be showing to you what are the equipment that I will be needed. So first is the stethoscope, alcohol, towel, canister, and small notebook for the documentation. After that, I will introduce myself and verify the client's name. Also, I will be explaining to her what I will be doing for this procedure. Good morning, ma'am. I'm Erica Joy Quitson, your nurse for today. And may I know your name po?
Ella.
Ella, Miss Ella. So, ayun po, i-discuss ko lang po sa inyo kung ano yung procedure na gagawin natin, kung paano po kayo makaka-help to participate po sa gagawin natin procedure sa inyo. So, ang gagawin po natin na procedure is yung chest physiotherapy po with postural drainage. So, it is an airway clearing method po na nag-involve yung manually or yung mano-manong pag-percuss natin sa chest wall nyo. Para po sa ganun is ma-eliminate yung mga build-up mucus sa lungs. So, yung sinasabi ko naman pong postural drainage, din po yung from the word na postural, yung different position nyo po. It depends on kung saan po yung lobe na affected by the mucus po. Then, ma'am, sabihin ko lang po if may mga instruction lang po ako na kailangan nyo lang pong gawin pag sinabi ko. Like, kunyari po sabihin ko, deep breathing po, inhale, exhale lang po, then, yung pag sabi ko, ma'am, umupo kayo, magka-cough lang naman po kayo. So, yun lang naman po yung gagawin natin sa procedure naman na gano'n. Ito po. So, next is provide client's privacy. Provide hand hygiene. So, after that, we will now go to the proper procedure in doing this chest physiotherapy and postural drainage. So, first is establish location of each lung segment. If the entire lung field is to undergo chest physiotherapy, the most affected area or the lobe should be drained first. So, next is keep the side rails up. If possible, arrange for the privacy. Next is remain with patient during the initial procedure and administer treatment for 2 to 4 hours as ordered. Then discuss the erosion exercise. So, ma'am, yung erosion exercise po or also commonly known as deep breathing exercise, siya po yung nakakatulong po ito para sa ating proper breathing and also nakaka-help siya para sa pag-clear ng ating lungs and nakaka-lower siya ng risk for pneumonia. So ma'am, pag nag-inhale po tayo, dapat po nanggagaling sa diaphragm natin and then pag mag-exhale naman tayo, kailangan ilalabas natin siya through the mouth po. Parang ganito po. So, inhale, then exhale po. Ganun po. So, next is, explain the importance of practicing PVD exercises after an operation. So, ma'am, yung PVD exercise po natin or yung peripheral vascular disease exercise is very important po siya, lalo na after operation. Kasi po, nakakatulong po siya para ma-improve yung circulation at the same time to ease the pain po. Then also, kasi itong exercise na to is nakaka-help siya para mas mailabas natin yung phlegm natin. So, next procedure is to auscultate all lobes for adventitious sounds prior to initiate PVD. Ma'am, i-auscultate ko lang po kayo para i-check yung sounds po. If may problem po ba. Inhale na lang po ako para sa likod. Inhale po. So, for the next procedure is for the percussion. So, for this video, the patient position, it will be the posterior, we will focus on the lower lobes, posterior basal segment. So, for the position of the patient, foot of bed elevated 20 inches, prone on pillow with head down. So, ma'am, i-position ko lang po kayo sa prone position po. Magalang po kayo ng So, yung chest mo po lang. So, for the location of this manual technique, it is in the lower ribs, close to the spine, but it is not on the floating ribs. So, in the percussion, the procedure here is first, we need to cover the area to be percussed with gown or towel para po maiwasan yung pagkakaroon ng redness sa area. Next is cup your hand and clap rhythmically and alternating hands over area to be drained. So each percussion should be hollow and not cause redness of the skin. So while doing the percussion, kailangan po relax lang yung elbow and yung wrist. And after that, we should percuss within 3 to 5 minutes over each segment. So, ito po, ito yung towel na ilalagay natin sa area kung saan tayo mag-percuss. Then after that, yung kamay po natin or yung hand natin is kailangan naka-C-shape para sa pag-clapping ng area. So kailangan po alternate yung pag-aano natin. Then, let's assume na tapos na po yung 3 to 5 minutes. Then, we need to encourage the patient to cough. Ama, pwedeng mag-cough po kayo. So, after that is to the next segment naman or sa next lobe po. So, ayun, kailangan lang din natin magkaroon ng towel para maiwasan yung pagkakaroon ng redness. So, for the next area naman po na ipe-percuss natin, so, lagyan po natin ulit ng towel para maiwasan yung redness. So, tulad lang po kanina, kailangan naka-C-shape yung kamay and alternate po and kailangan relax lang po yung elbow and wrist natin. So, let's assume na tapos na po yung 3 to 5 minutes na pagpe-percuss po natin. Then, also, encourage po ulit natin si patient na mag-cough. Ma'am, can you please cough po? So, after that, sige po. So, So, after the percussion, we need to auscultate all lobes for the changes in breath sounds. So, ma'am, i-auscultate ko lang po kayo ulit, ha? So after the percussion, we will go to the next procedure, which is the vibration. So in vibration, there are certain procedure then. So first is instruct the patient to breathe deeply through the nose and exhale slowly through the mouth. The next is place the hand flat over area to be drained, keeping your arms and shoulders straight. The next is as a child exhale or as the patient exhale, vibrate by quickly contracting and relaxing your arms and shoulders straight. The next is vibrate for several minutes depending on the viscosity of the secretion and the patient's tolerance. So for the vibration, kailangan po is yung kamay natin is flat lang po siya sa area kung saan tayo magba-vibrate. So, i-instruct natin siya na mag-inhale. Then, after niya mag-inhale, mag-exhale siya. Then, doon na po tayo mag-start for the vibration. Ma'am, can you please inhale? Exhale. Ma'am, pwede umubo po kayo. So, for the other side naman po, is same lang po sa procedure na ginawa natin. Flat yung kamay, and then for the inhale, exhale, then after the exhale, dun na po tayo mag-start ng vibration. Ma'am, can you please inhale? Exhale. Ma'am, pwede po kayo umupo? So, next is for the postural drainage. So, the first step is to loosen any binders or tight clothing. Next is lower head of the bed. So, the patient's head position in 30-degree downward angle if it's not contraindicated. So, the head is lower than the chest. So, place the sputum container and tissue within patient's reach. So, ma'am, ilagay ko lang po dito yung sputum container para in case kung mag-secret po kayo. Then, after that is tell the patient to remain in position 5 to 15 minutes. Ma'am, advice ko lang po na for 5 to 15 minutes is ganyan po muna yung position. Then, after that is instruct the patient to make short 5 rapid fire cough to expectorate secretion. Ma'am, pwede po po umubo ng 5 times. After that is ask the patient to maintain deep abdominal breathing. Ma'am, advice ko lang po or sabihin ko lang po sa inyo na yung maintain nyo lang po yung deep breathing, yung tinuro ko po sa inyo kanina. Then, after that is assist the patient to slowly return in a normal sitting position. Ma'am, i-ano ko lang po kayo? Sa sitting position na po. that is we need offer oral hygiene with mouthwash. So, ito mouthwash. So next is discard the container or send the sputum specimen to the laboratory if needed. So after that is remain with patient for 5 to 10 minutes and observe the patient condition. After observing, auscultate again the lobes for the breath sounds. Ma'am, i-auscultate ka lang ulit kayo. So, after the documentation, ask the patient on kung paano po ba, kung lumuwag po ba yung paghinga niya or kamusta po ba yung pakiramdam niya after natin gawin yung chest physiotherapy and postural drainage. Ma'am, tanong ko lang po kung kamusta lang po kayo yung pakiramdam niyo after po natin gawin yung technique na yun.
Okay naman, mas lumuwag yung paghinga ko sa higaan.
Thank you, ma'am. So, that's all for my return demonstration about the pulmonary chest physiotherapy and postural drainage. Thank you!